This is Dr. Aajay Shah. Today we are talking about heart attack and stroke prevention techniques. Again, like earlier said, if you ever have any further questions, please call my office at 517-347-3000. Thank you. Let's talk about the second risk factor for developing heart attack and stroke. Diabetes is becoming more and more frequent in America. 1 in 8 Americans has diabetes. After age 50, diabetes is as common as 1 in 6 Americans. People with diabetes are at risk of developing heart attack, stroke, kidney failure, blindness, losing limbs, developing neuropathy. So again, it's critical you diagnose diabetes in an early stage. Many of the heart attack and stroke risk factors are silent. That means they will not cause any symptoms. So if you have high blood pressure or borderline high sugar, you will not feel any symptoms. So it's almost your responsibility as patient and your right as a patient to make sure you have your blood pressure checked periodically and your blood sugar checked at least once a year in a fasting state. Once the blood sugar is above 100 in a fasting state, you are starting to have a risk for diabetes. And once the sugar is above 127, you have the diabetes. The treatment of diabetes over the last 5 years has changed dramatically. We do not use some of the older medications, for example, glipizide type medications which we call sulfonylureas. So make sure you ask your physician what type of diabetes medicine best fits your needs. The common medicine which I use in my practice is metformin, which is glucophage, Actos, Januvia, and early use of insulin. Again, if your blood sugar is difficult to come under control, make sure you ask your primary care physician to start using insulin earlier in the therapy. In this country, insulin is started sometimes very late, and that's when complications happens in people with diabetes, including dialysis, heart attack, stroke, limb loss, amputation, and blindness. So please ask your physician that if it's difficult to control the diabetes with medications, start the insulin therapy early. Medications like sulfonylurea type medicine, which are older medications, and even though they are very inexpensive and cheap, they are not the best medications. So talk to your primary care physician to make sure you get the most updated medications with best effects in terms of preventing complications of diabetes. This is Dr. Aajay Shah. We're talking about preventing heart attack and stroke. Thank you for listening. Call if you have any further questions at 517-347-3000. Thank you.